Our medical expert, Dr. Payal Kohli, is here with us for the start of Breast Cancer Awareness Month.
This interview is happening at such an important time because more younger women are getting breast cancer. And why is that?
I mean, there's so many reasons for it. One is better detection. We're actually screening more, we're looking more. But it's not all detection bias, it's also changing risk factor landscape. So think about who we are today as compared to 30 years ago. There's more obesity going around. There's more use of chemicals, cosmetics, plastics, environmental exposures. All of these are thought to disrupt our endocrine axis as well. And there's more risk factors like alcohol. Women are using more alcohol than they've ever used before. Women are having babies later, and that's a protective factor. Women are using more birth control, less women are breastfeeding, and every woman is having less babies on average. All of these can increase our risk.
Let me ask you, and this is, I don't think there's any science to support it, but you know my sister had breast cancer at a young age.
Yes.
And we were trying to unpack why that was, because she takes very good care of herself. The only thing we could think of was she worked for so many years overnight shifts as an ER nurse.
Oh, yeah.
Could that sort of disruption with hormones and things like that ever impact it? I've also heard that deodorants can cause breast cancer.
Deodorant?
Yeah, like certain ones with certain chemicals in it. Or is any of that possibly like factual?
So let's break that down. Working overnight, they looked at nurses who work the night shift, certainly disrupts your circadian rhythm, which causes inflammation, which can lead to cancer. Because cancer can be a disorder of the inflammatory system. It can be something that our immune system can fight off, but if our circadian rhythm is disrupted, we have that, then it can't. But deodorant is a myth, actually, and it's out there because women think about our deodorant. We put it in the armpits, which is close to the breast. Most breast cancers happen in the upper outer quadrant. Deodorant has aluminum-based products in it, as well as some parabens, and all of these are thought to absorb into the skin. So they looked at this at length, but the FDA, the American Cancer Society, everyone says that there doesn't appear to be a causal relationship with deodorant use and breast cancer. But to your point, there's a lot of factors, environmental factors, that we haven't yet identified. But it means that us as young women need to understand this is no longer an old woman's disease.
Right.
It's now a young woman's disease. Monica was only, what, 39?
39, I believe, when she was diagnosed.
Yeah. So we need to be proactive about our screening.
Okay.
And then 40 being the age you start to get mammograms. I remember I had a breast surgery, so I went and got a mammogram at 36, and they found like a nodule. I had to get a biopsy. It was benign, thank God, but I wouldn't have known that had I not got the mammogram at 36. But they say you don't have to get them until 40. Do you think that should be younger?
So I think every single woman, regardless of her age, should calculate her lifetime breast cancer risk. And it's an online calculator, and it puts your family history, your risk of exposures, whether you've had chest radiation, all of those things into a calculator and tells you. And if your risk is high, or you've had multiple first-degree relatives who've had breast cancer, especially if they've had it early, you need to start before 40. And depending, again, on how high that risk is, they'll tell you how much earlier. Some women are starting in their 20s to look. And for some women, mammograms aren't enough to screen. So 50% of women have dense breasts. And that means,
Yep.
And you can't tell unless you look on a mammogram if you're dense or not. And so you're looking for white on white. A tumor is white and your breast is white if it's dense. There's not enough fat to really bring out the black, so you can't find it. So these women actually need to get MRIs or ultrasounds to help with their screening.
Great information, Dr. Kohli. We are out of time. I wish we could continue to talk to you. We'll be right back.